Hi, I'm Zia Zaman. For 6 years, I was the Chief Innovation Officer at MetLife, and that's where I got to know Anthony in Notions. We were running a reverse pitching program called Collab, and Notions was one of the winners. When I was the CEO of LumenLab, we delivered a ton of projects, some of which won some major awards around health, aging, and wealth, and Notions was one of them. Let me tell you a little bit about what our vision was as an insurer. We wanted to solve the interesting job to be done of our actual customers. What they wanted is to live a longer, happier, thicker, fuller life. And I think that Notions and Anthony understood that the best differentiator might be that our policyholders simply live longer than their policyholders. But how you get there isn't easy. You have to better understand how to augment classical actuarial data with health data to better classify risk. So if, as an insurer, you could select customers who make better lifestyle choices, you win. If you can build models that have feedback loops that assist with preventative health, your customers win. And finally, if you can bend the risk curve, you can materially change health outcomes at scale. And that's when everybody wins. And that's what's so exciting about the potential of Notions. So how does it all work? Health data added to actuarial data. Lydia AI enriches customer data with health data. I did a groundbreaking project on health data within the Singapore government, and it was hard, but it got the attention of 6 regulators and Christine Lagarde. What we knew is that 75% of the loss in a life and health insurer comes from 5 major diseases: cancer, dementia, cardiovascular, diabetes, and mental health. So what if you could improve health outcomes for all 5? Here's the path to success. More data leads to better products, leads to clearer underwriting, better interventions and customer empowerment, which leads to improved health outcomes. That's the vision of Notions.
Hi, my name is Anthony Lee, co-founder and CEO of Knowtions Research. Today, I'm really pleased and honored to introduce you to a new category of health insurance products called Pay How You Live. It's our journey of insuring the next billion people. Now, insurers don't fear high risk. They fear unknown, unmanageable risk. And with seniorization and people getting older and getting more sick, health risks are increasingly unknown and difficult to manage for health insurers. Lydia AI is trained on global health data, and this is a huge difference to how insurers have traditionally defined health risk. Traditionally, they've always been focused on age and gender to design products and pricing. But in the new world, Lydia AI, trained on open health API data, we can help predict risk continuously. Lydia AI uses this kind of health data to predict more health risk more accurately. Our competitors are using step count data to predict mortality and anything from generic country risk factors to predict global disease risk factors for morbidity. Now, Lydia AI Health Score is based on open health data. No amount of step count data is going to be able to help you predict cancer and critical illness. Now, once you know a little bit more about risk with health AI, we can now begin redesigning products. And we're talking about billion data points of Lydia AI, trained over 20 million lives from multiple countries and growing. With more kind of health data from working with diagnosis, drugs, and treatments, you're going to see better models, performant models, models that actually, in insurer terms, translate to new, unique capabilities. And that's accelerated underwriting, extended coverage for seniors, extended benefits and bigger consumer discounts, and more complex benefit payouts. We've already done this, embedding Lydia AI directly into the insurance product. And this helps insurance companies build insurability, inclusiveness, and product diversity. Now, the first step to doing that is actually designing the insurance product. So we work with the actuary team, and we convince them of the powers of the health score compared to their actuarial table. We then convince the underwriting team that, hey, you know, if you use open health AI, you still get the same kind of alignment with underwriters. And more importantly, over 20% increase in people who were rejected, postponed, to standard. All of that being done by API-based integration. Furthermore, the third part of our journey is empowering customers. Customers have an in-app experience that give a comprehensive health assessment that gives you the actual protection gap that is designed and individualized to you. Lydia AI, in short, is a sandbox for digital product creation. You're going to see a new digital customer experience where we acquire customers and we help customers actually understand their healthcare data and their health status. And on the other hand is helping the insurance companies build those capabilities to help the consumers. We're talking about different kinds of analytics at different life stages, different underwriting capabilities, and an integrated healthcare ecosystem. This is dramatic. It's a huge change. Think about this as a woman who is 35 and buys insurance, and she renews her product, and that product is being renewed based on health AI. And she gets a product that she needs tailored to her own health condition. And as she ages from 45 to 65, all of her products grow with her because they are growing with her health score, essentially. And that allows us to really design insurance products from the philosophy of preventative medicine. We've already done this already. We won both an award from MetLife and Prudential in the same year. We used Lydia AI to relax underwriting, and we did this for 18 pre-existing diseases. That's actually adding 2,000 new in-force policyholders per year for the insurance company. With an average policy amount of $7,000 US, this is a huge top-line growth. Using Lydia AI, we've also embedded it directly into intervention programs, and that has helped really insurance companies save $8 million US per year. So we're really happy to launch and announce the first of many pay-how-you-live insurance products in Taiwan. Taiwan Life is a subsidiary to CTBC, the largest retail bank in the country, and we're very pleased and honored to be able to work with them, with reinsurance company RGA, to build that customer sort of pipeline and to build that new customer experience where people have control over their own health assessment. Our team is visionary. We're vertically focused, and we're led by our executive chairman from MetLife, ex-CIO. We're working with our CIO who built Compare.com, the US largest auto insurance comparison website. And with everyone else on board, you're talking about FICO, Willis Towers, and Manulife Prudential. This is the right team to actually do the job. And I'm glad actually to have the Canadian government back us, Alibaba back us, and 500 and SparkLabs as well. Now, our mission is to ensure the next billion people. And what does that mean? Well, it means using an alternative source of data that insurers have never used before, health data. That is the only way to actually provide continuous, accurate risk assessments to build the next generation of digital life and health insurance products. Thank you.